Good day, everyone. I, Kaya Cassandra Ansagay, together with my co-student nurse, Miss Sulit, Miss Singh, Miss Corpus, Miss Embultorio, Miss Cruz, and Miss Kamba from Our Lady of Fatima University have gathered here today to discuss the case scenario of Mr. Steve Rogers. So, Steve Rogers, an 80-year-old man, was taken to the hospital by his daughter, who stated that her father was weak, vomited 4 times, and has pain in his belly. She also informed that his appetite is poor and is very anxious. On assessment of the patient, he is lethargic, state his pain is 9. On a scale of 1 to 10, he vomited 3 times with 100 milliliters each of venous fluid and passed approximately 150 milliliters of urine in the urine. His temperature is 38.2 Celsius, pulse of 80 beats per minute, respiration of 22, and blood pressure of 140/80. Next is the assessment.
Right. And for the assessment, we have subjective data. And when we say subjective data, this is based on the influence by personal feelings, taste, or opinions. So in this case, Mr. Rogers' daughter stated that her father was weak, vomited 4 times, and has pain in his belly. She also stated that his appetite is poor and he is very anxious. When it comes to pain, when we rate the pain of the patient 9 on 1 to 10 scale. And for the assessment objective data, so when we say objective data, this is also anything objectives that sticks to the fact, but anything subjective has also feelings. So the vital sign of the patient, temperature 38.2 centigrade, pulse rate 80 beats per minute, respiratory rate is 22 CPM, blood pressure 140/80. The patient is also lethargic, vomited 3 times, 100 milliliters of greenish fluid, 150 milliliters of urine in the urinal.
Here are the possible diagnoses. First is the acute pain. The patient pain in his belly, which he rates at 9 on a 1 to 10 scale, is an indication of acute pain related to unpleasant sensory and emotional experiences in the abdominal region. Acute pain is also linked to fever, weakness, which is evident in both the patient's subjective and objective data, as well as increased respiratory rate tachypnea, with the patient's assessment in respiratory rate with 22 and elevated blood pressure with 140/80. And also the patient is an active vomiting, which causes pain in his abdominal area.
Imbalanced nutrition or less than body requirements. Less than body requirements related to metabolic abnormalities as evidenced by the patient's poor appetite, feeling anxious, lethargy, and intestinal dysfunction due to abdominal pain. Sa situation na ito, dito yung patient na nawawala ng appetite and nanghihina because hindi siya makakain. And sa situation din ito, dito nakakaranas yung patient ng pagbaba ng immune system dahil walang pumapasok na pagkain sa kanyang katawan.
So, the last one is the risk of fluid volume deficit due to vomiting and fluid loss, as evidenced by the patient vomiting 3 times or 100 milliliters of greenish fluid, causing him fluid loss that make him to vomit. And the fact that his urine output is decreasing, passing only about 150 milliliters of urine, which may lead to dehydration. Next is the planning.
The planning, short term. After 6 to 24 hours of nursing care, the patient will be able to take their amounts of calories, nutrients, as evidenced by pain scale of 2 out of 10, absence of vomiting, with normal urine output of 0.5 to 1.5 cc per kilogram per hour. The second will maintain their vital sign with normal rate temperature of 36.C RR of 16 cpm and the BP with 120 over 80 millimeters of mercury. The the third patient will report feeling less lethargic because a person who overdoes themselves physically their energy stores leading to a low as they recovered. The last patient will have equal intake and output because too much output can cause dehydration and if the input so much can lead fluid overload, but both situation can put the patient at the risk complication.
The long term of planning, patient will demonstrate lifestyle changes to avoid progression of dehydration. To avoid dehydration, drinking more water or other liquids. Patient will describe symptoms that indicate needs to consent the healthcare providers. The patient must be competent to make a voluntary decision about whether to undergo the procedure. Balance will achieve and maintain intake and output with adequate hydration. Drinking enough water each day is crucial for many reasons to regulate our body temperature, keep our joints lubricated, prevent infection, deliver nutrients to our cells, and keep organs functioning properly. Being well hydrated are also improves sleep quality, eye cognition, and mood. Next.
After the diagnosis and the planning, we come up in this intervention. So first intervention is provide analgesic as prescribed. On the rationale on this is to promote pain relief and patient comfort without the risk of overdose. Second, implement comfort rounds that regularly assess for clients' comfort needs. The rationale on this is regularly 1 hour to 2 hours rounds to address the pain, positioning, and personal needs of the patient. And it also to increase the comfort and safety and satisfaction of the patient. In the second intervention, we promote the say the comfort for the patient to feel better. The third intervention is assess the patient's ability to obtain and use essential nutrients, provide a pleasant and quiet environment. On rationale on this is several factors may affect the patient nutritional intake, so it is necessary to assess accurately. A pleasing atmosphere helps in decreasing stress and it's more favorable for eating. For the number for interventions is encourage the patient to drink copious amount of fluids as tolerated or based on individual needs. A patient must have restricted oral intake in an attempt to control urinary symptoms, reducing homeostatic and reserves and increase the risk of hydration and hypovolemia. Next, the intervention number 5, monitor the patient's fluid status in relation to food intake. On rationale on this is most fluid comes into the body through drinking. Water in foods and water formed by the oxidation of foods. Verifying if the patient is on a fluid resistant is necessary. These factors fluid intakes and fluid needs and routes of replacement. The number 6 intervention is ensure the patient nutritional needs are met, including adequate hydration, and the rationale on this is supplication for the necessary nutrients is then made to compensate for nutrients loss because older adults are prone to electrolyte abnormalities because of the failure of regulatory mechanism associated with heart and kidney disease, a decrease in ability to reabsorb sodium, and loss of diluting capacity in the kidneys. So, you can see naman po na finocus natin ang ating intervention for more para mabawasan ang pain ng patient and to give a balanced nutrition.
For the evaluation, after 6 to 24 hours of nursing care, the patient goal is met by patient attained adequate amount of nutrients and relief pain rating 2 on 1 scale is free from vomiting, achieves normal or urine output 0.5 to 1 cc per hour. Ang ibig sabihin dito, yung patient natin ay hindi na nakakaranas ng pain and hindi na po siya nagsusuka. Next is, patient maintains stable vital signs and feel more energetic. The patient's vital signs are now normal and free from lethargy. The, the patient has achieved equal intake and output within 24 hours. Yung patient natin dito nakakakain na, tsaka nakakapag-take na ng mga tubig. Next is, patient will demonstrate lifestyle changes to avoid progression of dehydration. And now, sa ano na to, yung patient natin, kaya niyang maintain ang kanyang lifestyle para maiwasan ang ganong situation. Next is, patient describes symptoms that include the need to consult with healthcare provider. Lastly, patient's balance is achieved and maintain and intake and output with adequate hydration. Hindi ito ibig sabihin kaya niya na po yung mag-hydrate sa sarili niya para maiwasan yung pagbabalik ng sitwasyon niya. And that's all. Thank you.